Okay. Yep. I'm going to call the meeting to order. This is a regular Boulder County Board of Health meeting. Today's date is Monday, October 12th, and the time is 5:32 p.m. Can I have the board members announce themselves? Again, this is Greg Thomas, Board President.
Hi, this is Landry Fagan, board member.
This is Brooke Harrison, board
Hi,
member.
this is Morgan McMillan, board member.
And I don't see Jorge on there, so. Okay, and now can we have all staff members attending announce their names and titles? Jeff, if you want to do that, that's fine.
All right, Jeff Zayak with Boulder County Public Health. I'm the executive director. And then I'm going to go just down the list. We also have Sheila. And Sheila, I think you're sharing your screen, if I'm not mistaken. So just see if you're sharing it by accident. But Sheila Davis is on the line. Lane Drager is on the line. Yep, thank you. Melissa Ellis is on the line. Megan Hatton is on the line. Kate Haywood from our county attorney's office is on the line. Rita Mangan is on the line. We have Susan Motika on the line. We have Lexi Nolan on the line. And let me know if I've missed any staff that are on the line.
Jeff, this is Nadine. I'm on the line as well.
All right, excellent. Thanks, Nadine.
So we do have a quorum, so we will proceed. So this regular meeting of the Boulder County Board of Health is now called to order. This meeting was posted on the Board of Health's website as required by law and included the teleconference phone number and conference ID so members of the public could participate in the meeting. Due to the current pandemic and the need for social distancing and compliance with the public health order, this meeting is being held online and telephonically as authorized by the Boulder County Board of Health bylaws. So let's see. Do we have any members of the public who want to give comment on any item not on the agenda? Okay, well, I'm not hearing any comments on non-agenda items. If you are giving comment for an agenda item, that will come when that item is up for discussion. So moving on, we need to approve the consent agenda, which consists of the September 14th, 2020 regular meeting minutes and the September 23rd, 2020 special meeting minutes. And again, if you're a board member, you need to call out anything, you can, and we can just put it in the old and new business. If not, somebody can make a motion to approve.
This is Brooke. I make a motion to approve the minutes.
A second, this is Morgan.
Okay, thank you. We have a motion and a second. All in favor? Aye.
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 Okay, that motion passes. So on to item 3, public hearing on adoption of revised body art regulations. So after staff makes opening comments, I will explain the public hearing process.
And we have Lane Drager on the line and Melissa Ellis both, I believe. So I'll turn it over to whoever wants to kick this off.
I can start. This Lane. Thanks, Jeff and Greg. So we came to you last month talking about the revision process. We've been working on that for quite a while. Had a little delay with COVID, but felt it was still appropriate to go ahead and move forward with this. We did a few stakeholder meetings last year, and really the impetus was both that our regs had not been updated for quite some time, and at a national level, the National Environmental Health Association had coordinated effort to develop model regulations. And so we really looked at that very closely and really mirrored most of our changes related to that. So that was probably the biggest driver. And then did meet with our body art stakeholders. We had 2 meetings to discuss this, and really I didn't have a lot of issues. One of the areas that's not part of these that we still may explore in the future was the idea around licensing individual artists, but we have not seen a model yet that at least the artists certainly get behind, and that we didn't feel that was appropriate to bring forward at this time. We did provide a summary of major changes, so I'm happy to go through that as well if you'd like, but we did share that with you. The one other, I guess, major change is that piercing the lobe of the ear is something that would be triggered by our regulations. It had been exempted and when the origins of the Colorado rules came in place, but I think at the national level that is no longer the case, and we didn't really ever understand the logic there, especially given many of the places that do that do not have any training for their staff, do not do any infection control, and often that's very young children that are getting kind of some of that exposure. So, and we only have one facility we believe that would fall into that category of now needing a license. So again, I'm happy to answer any questions that the board may have.
Okay. So the public hearing process, if you are on the call and you have any comments, you'll have 3 minutes per person to make your comments. You can defer your time to another person who can pool the comment time. And then all speakers, please provide your names and addresses for the record. And then once the hearing is closed, no further public comments will be accepted unless solicited by the Board of Health. So I now declare the public hearing open. Is there anybody who wishes to speak from the public? Okay, I am not hearing anybody who wishes to speak. So Lane, if you want to go ahead and take it away, we are ready to go.
Greg, I think you need to close the public comment.
Oh, okay. So now the public hearing is now closed.
So I'll just share with you the summary of the major comments in case you just don't have that in front of you. And again, instead of reading them all to you, I'm happy just to jump to any that you may have questions on or any of the other. I know we sent a full summary of all the changes that were made. So again, if there's any questions you have that you want further explanation, feel free to ask. And between Melissa and I, probably mostly Melissa, will answer your questions.
Lane, this is Greg. So it's probably not a common practice that body artists are under the age of 18, right?
I think that certainly people may start to apprentice at a younger age. We just wanted to make that very clear distinction. I think that the national level also that has been done, given that people under the age of 18 can't have body art performed unless there's parental consent or guardian consent. So we felt that it made sense that artists be of that age, similar to alcohol being served by people that are of legal age to also consume it.
Okay. Any other questions from the board? Seems pretty straightforward, Lane. Thank you for sharing that after the last meeting. So are we now looking to, so the staff recommendation is to approve the regulations. Is there any additional comment, Jeff or Lane or Melissa?
I think the only other piece would be the date that these would go into effect. So if you want them to go into effect immediately, if you want to have some period, I think we've done a pretty extensive job of sharing these with the body artists. But there is one facility who, again, has not been regulated. So if you wanted to have some period of time before they go into effect, any of those options, I think we just would want your direction of when you would want these to be into effect so that we can communicate to the artists that these have gone into effect and specifically do the outreach that now they are in place for that facility that was impacted. We did try to reach out to them. They did not join any of the meetings, but that might make sense, is to have a little time so that they're not caught off guard and suddenly subject to these. We certainly will work with them to get into compliance regardless. We would not go out and start doing any kind of immediate enforcement.
Lane, have you heard from that facility at all?
No, we haven't.
Okay. And what sort of time frame, considering that you haven't heard from them at all, what kind of time frame do you think would be reasonable?
I think we could push it off to January 1. That would give, more than 2 months time. Probably the big pieces for them are really looking at having an infection control plan, having training for staff. This might impact them on staff who are performing piercings, given that often like piercing pagodas and clairs and places like that do that, and may hire high school kids to be part of their staff. So just to make sure that there aren't significant impacts to them. We don't have a ton. We don't have clairs. The mall, or the Flatirons Mall is actually in Broomfield. So we don't have a lot of facilities that this will apply to. I think the other piece that probably makes sense, we do need to do some additional work with our IT folks on our checklist and database. So January 1, I think would be a pretty solid time frame.
The one unregulated facility also, this is Melissa, sorry. It's a jeweler here in Boulder, Walters and Hogsett. So it's actually not their main business. It's a fine jewelry store. And they also do ear piercing for people. I don't know if that changes anything for them. I don't think it's a main revenue stream, but they also might not be really set up for that type of business, to be honest. So I'm just throwing that out there, that it's a jeweler.
Got it, thanks.
And they may elect to stop doing ear
Just
piercing.
stop, yeah.
Okay, so it sounds like January 1st is a good recommended date by staff. Will allow additional time for outreach and preparation for any of the facilities that will need to come into compliance with these new rules. Any other questions from the board before I ask for a motion?
Not for me.
Okay. So could I have a motion?
This is Brooke, and I move that we approve the revised Boulder County body art regulations with the date to enact the new regulations is January 1st, 2021.
This is Landry, a second.
Okay, we have a motion and a second. Any discussion? Okay, all in favor?
Hi.
Aye.
Aye.
Okay, motion carries. Thank you very much, Lane and Melissa.
Thank you to the board. Appreciate
Thank
your
you.
support. Have a good night.
You too.
Have a good night. Thanks.
Thank you.
Okay, now we are on to item 4. which is the update on current COVID-19 pandemic.
Okay. Sharing my screen with you. Let me know when you can see that.
We can see it.
Excellent. Thank you. So this is to bring you up to speed. I just presented last week, but this will bring you up to speed on the data that you saw last week and where we are this week. And I'll report here both on where we are relative to the state dial as where we are relative to the two public health orders and the metrics that we're tracking. So you have a good sense of that. This first slide is just a slide that shows the total number of state cases per day. As you can see, just as we saw last week, we are in what they are referring to as a third spike. We definitely are seeing cases across the state in multiple areas. This is, as I mentioned last week, and I'll probably mention it several times in this presentation, a result of people just not paying as much attention to social distancing. So there's just less social distancing occurring, and it's creating additional cases across the state. This is our metro regional graph, and this one is always really nice to look at when you see this downward slope. We are moving down. We're now the second lowest. Unfortunately, you can see here that Denver is spiking, Adams County is spiking, and others are spiking. And this is associated with some of those trends. Denver is being driven partly because of the university that's there, both the University of Colorado as well as Denver University. So some of these cases are directly associated with that. But we have headed in the right direction. We want to keep seeing this go down closer to where our baseline is down here. And I'll show you a baseline and one other graph as we move forward. So this is, again, the descriptions of the dial at the state. And this is how the state classifies us in terms of the level that we're at. And then what follows each of these levels is the associated restrictions that go within each of these levels. So the lower you are on the left-hand side, the less restrictions there are. The farther on the right-hand side you are, the more restrictions there are. When we started the CU surge, we started in safer level 2. We are now back. As you'll see, they're tracking 3 metrics, and we are now back at safer level 2 again, which is great news. They are tracking new cases. They are tracking percent positivity rate and stable or declining hospitalizations. And then based on these 3 primary indicators, they're assessing where each local public health agency would fall on the dial. So here's our 3 primary indicators. Our incidence rate as of today in the AM was 127.5 per 100,000. That puts us back at safer level 2. We came all the way, I think you all know, we came all the way from stay at home. We had a really high incidence rate for a time being above 400 at one point, and we've come all the way back down to 127 per 100. I anticipate that we'll continue to drop even more between now and the end of next week, but some of that is going to depend on some of those general trends you saw in social distancing, as well as what happens as we begin to loosen things up a little bit more at the University of Colorado. Our second indicator is the positivity rate, and we're at 2.7%. And that's exactly where we want to be. We want to keep heading our direction down. And again, this was updated 10/12 in the AM. And then the third one is decreasing or stable hospitalizations. And we have had 11 days. The way they track this is on a 14-day period. And we have had in the last 14 days, 11 days of decreasing or stable admissions. So there also is, just to make note, that Emily and Megan are looking at the data that they're recording from this at the state, because it may be a different data source than when I'm going to show you our data. It's being pulled from a system called EMR Resource, which is what other counties use as well. But we just want to make sure that we're able to adequately and accurately categorize what our actual counts look like. I'll talk about that a little bit more in just a second here. This is the key mitigation metrics for the public health order for gatherings that you saw go in place that we presented to you on the 7th and that you approved. Just as a reminder, there's baseline, which is where we want to get back to. When we're at baseline, that means we go back to no restrictions except for what the state has in place. When we came to you last week, we were in level C. Based on the data that we looked at this afternoon. We have 2 indicators in level A, and we have one indicator in level B. And again, this was as of 10:10 this morning, and this percent positivity rate is associated with specifically 18 to 22-year-olds in the county. So it's different than the positivity rate I just showed you. We will be meeting. We have a administrator meeting that happens each morning on Tuesday mornings with some of our staff to look at these levels and determine what level we will move forward into this week. So as a reminder, you gave us the authority to evaluate this data and then make a determination weekly on what level we would have relative to the order. So we will likely move out of level C and move down. And we will make that decision tomorrow morning, and then that will be communicated through our joint information system to the public by 12 o'clock tomorrow. In addition, we also have a standing meeting with the university, with students, and with parents at 12 o'clock. So we will communicate what level we're at to that same group as well. So we'll be able to get the information out pretty consistently each week in terms of what level we are at. So this is all good. We were above 1,500 when we were presenting to you before. So you can see it's been a significant drop just in the last 5 or 6 days since we last did the presentation to you, and that's exactly what we want to continue to see. This is just real quickly the chart again. You can see light blue is University of Colorado cases, and the dark blue are cases that are not affiliated with CU. So this is a little bit of, these are a little higher than normal, and we want to see trends that are down below 20, basically to keep us consistent with where we've been in the long term. But again, we do know we have challenges associated with less social distancing occurring in general across populations, and we want to keep messaging the importance of that as we move forward. Just a 5-day rolling average for our new cases just shows where we were and where we're at. We want to keep driving down. Sorry, I lost my... This is again that trend in 2-week cumulative incidence for 18 to 22-year-olds, which was the primary driver here. We're headed back. This is that baseline that I was talking about. It's 200 some odd cases, and we're heading towards it. And this is exactly what we want to do. We don't want to see this tail and flatten here. We actually want to see it keep driving down so it's closer to these baselines on the bottom here. This is our percent positivity rate. So we are headed definitely in the right direction. It's important to note this is a 5-day rolling average. The state one that I showed you that was 2.7 is a 14-day. So we want to see the 5-day because it reflects trends more quickly. In our 5-day, where it looks like we're at just about 2% at this point. So we are again headed exactly in the right direction and where we want to stay. Hospitalizations, as I mentioned, when you look at our hospitalizations, they are going up. And I don't have a demographic breakdown, so I don't know exactly what our hospitalizations look like right now, but I can make sure I bring it back to you in my next presentation. We are seeing an upward trend, though. We still are not concerned. And again, we meet with our hospitals on a weekly basis. We're not concerned that we're running into capacity issues with the hospitals, but we obviously don't want this trend to continue. We want to keep hospitalizations down as much as possible. And again, this is directly associated with less social distancing that we're seeing across the state. Here's the state hospitalizations. You can see this was the July peak that they had, and we're starting on that upward trend again, associated with those same things I was just talking about. The key takeaways here are, again, we're at dial metrics at safer level, at home level 2. That is very good news because that means that we don't have to make adjustments in terms of some of those restrictions that the state would require us to do if we couldn't get back to where we started. And I want to thank all of our staff, our partners. This was definitely a joint effort. City of Boulder, Boulder County Public Health, and the University of Colorado all were partners in this, and we couldn't have done this by ourselves. But this took a lot of work to drive those numbers back down. Our mitigation plans being implemented. We're doing weekly evaluations. As I said, we'll make adjustments on Tuesday mornings and we'll communicate it out on Tuesday afternoons. Numbers and rates are coming down, and we hope to be at baseline, as I mentioned, next week. We did have a concerning report this weekend from the University of from the City of Boulder. and our police folks who are doing monitoring on the Hill. We are following up on 2 reports of parties that occurred this weekend, and determining next steps associated with what we will do to pursue disciplinary action and enforcement around those 2 parties. We've had lots of complaints from parents and students about the orders. The feedback we're getting is parents and students feel like this is targeting a lot of students that aren't part of the problem. And unfortunately, we clearly see when we look in that population that it is clearly, as I had showed you in previous graphs, when we separate out the 18 to 22-year-olds that are not CU, that number drops down to a baseline. So we know that we are capturing both people that are demonstrating poor behavior, as well as some that are, and it would be extremely difficult from an enforcement standpoint to separate that out. It wouldn't be doable. So we are continuing to respond to all those complaints, and again, we're sharing information about why we've taken the approach that we have and how people can move to less restrictive actions by following the behaviors that lessen that rate, again, in that 18 to 22-year-old category. I just talked about the statewide increases. We do have some fall challenges coming, and we know it. We are going to have people inside. We have holidays coming, which means more people wanting to gather, and we have flu coming in as well. So we are doing a lot of messaging around this, and it is going to come down to these individual behaviors. That is what drives those outcomes that we've been looking at throughout this whole thing. We certainly can't be everywhere all the time. We know that orders in the community make a difference. You can see that individual behaviors, as well as orders that we've put in place and outreach that we've done, has definitely made a difference at driving our numbers down. But it really does come down to those individual behaviors and people taking responsibility to make sure they are social distancing. They are not gathering outside of what the order allows, that they're masking, and that they're using good personal hygiene. And that's it, unless you have questions for me.
Jeff, I have a quick question about what looks like social distancing burnout with the increase across the state. Have there been discussions at a county and a state level about how that will be handled? Like, are we looking at additional orders to force more social distancing if this continues to go up?
So, and I don't know if Chana, are you on the line? Chana is not on the line. There's been multiple conversations that have been occurring. There is some social distancing and masking marketing campaigns that are being released from the state health department. You probably, or you may have seen the one from Kaiser Permanente that is out there right now. And there's going to be more like that are happening. So the state is taking an active role in trying to do some more messaging. The messaging was really well tested with multiple categories of folks across the state. Sheila probably has more information than I have on this as well, because Sheila was part of the conversations here. But they are releasing that messaging now, and we should be seeing that coming out from a statewide level. There's also been a lot of work that's been done between the metro counties around messaging in terms of how to make sure we keep reemphasizing the importance of these things. Ultimately, the governor could decide if things are not working and those numbers are going up across the state at a level that feels unsustainable, or that feels like it's going to put pressure or risk into our hospital and healthcare systems, then the governor would obviously make determinations on what kind of orders may be needed in order to stem something like that. That doesn't work very well for anyone, as I know you're aware, and we certainly don't want to get to that point. So the messaging and education and the push on that is what's most important, to try to make sure people are doing everything they can to make sure that they are masking and social distancing. But you're absolutely correct. I think we are seeing fatigue. I hear about fatigue with this virus a lot. And my hope is that we will have a vaccine that's available more widely by the middle of the summer, and may have a vaccine that's more available to high priority populations earlier in 2020 2021, but time will tell when we actually get there.
Hey, Jeff, this is Greg. So when you showed the hospitalization slide and it looked like it was all green, is that hospitalizations associated with COVID, or is that just total hospitalizations?
These are hospitalizations. I don't know the answer to that. Let me just make sure that.
It's from the COVID dial. I imagine it's related to COVID.
Okay.
I'll confirm with you, Greg, though. I'll confirm with the whole board. I'll send it
Yeah,
back.
it's okay. I
Just
mean,
to
I
make
just
sure.
know with flu season, you can get those confounders. So I'm not sure if they break that out separately.
Yep, I will follow up just to make sure.
Susan, you have your hand up?
Thanks, Greg. And Brooke, I just wanted to give a little more background and context to what Jeff said. The campaign is going to be called Step Up Colorado, and the PIOs from our metro area jurisdiction were involved and very, very heavily involved, along with other key stakeholders, as Jeff said in the messaging, and that this is going to go out very intensively, a lot of different announcements and messages through December 31. And a specific question I asked at this presentation is whether we would be able to have products and things that we can use and we can take forward after this December 31 funding ends and the contract ends, and the answer is yes. So more on this in future meetings, I would say.
Thanks, Susan.
Thanks, Susan.
Oh, sorry, Sheila, I see your hand up. I can.
Oh, okay. I just have a comment to add to what Susan said. I mean, the campaign speaks to all demographics. I was really impressed by it.
Thank you for adding that. This is Morgan. I just had two things. One is, Jeff, I know in this presentation anyway, it doesn't break out any school district data. I saw that St. Vrain has sort of made public their tracking of cases, and it looks like BVSD is intending to do the same. I just know that's going to be certainly of interest to the community. Is what are we seeing as schools have resumed in person now for a couple of weeks and more students to be added?
Yes, they are. I did chat with BVSD as well, and I know their intention is to move that forward. What they won't be able to do is they won't break that out by county. So they're right now, St. Vrain's includes both counties, and BVSD intends to include both counties as well. I did share a recent article this morning that came from the Brown University, who had done an assessment of 200,000 kids across the United States and looked at transmission rates associated with K through 12. And the good news is that they're not seeing any super spreader events associated with kids in school, which is a positive thing, very low transmission rates. So very similar to what we're seeing with like Cherry Creek School District and others. The majority of the schools that have had to either scale back or close has not been because there's been large spreads of the virus, but because of operational issues that become challenges when teachers and kids are out for a fair amount of time.
Thanks for that update, Jeff. And the other thing I wanted to say was just, to commend Jeff, you and the whole team for acting so quickly in response to our increasing cases, and to the city and the university and their partnership, and to the students for really responding to bring us back down. So thanks for how fast you all jumped into action on that. It seems like it has paid off. So that's great. Thank you.
Thanks.
Yeah, it is great. Thank you. And Jeff, is the area command structure, will that continue until you don't have the university order anymore, or will that stay in place in anticipation of the fall and winter?
So that will, the area command will end at some point. We have agreed at this point to extend it through the end of October. But those orders and the need for the university, the city of Boulder, and for Boulder County Public Health to collaborate is going to continue past that area command. So what'll happen in the area command structure before it transitions or demobilizes, I guess, is there'll be a plan that's set up that helps make sure that we have a structure in place that allows us to keep coordinating without the area command structure in place. So, but that'll likely happen at the end of October. We've got commitment to at least extend to the end of October.
Okay, good to know. And then speaking of the end of October, assume there's probably some interest, although it probably hopefully being outdoors on trick or treating. So I'm assuming there will be some guidance from city or counties on safe trick or treating.
Yep, there has been guidance that's already been issued. It was issued last week, I believe, that went out statewide. The state put the guidance together. It's on our website at this point. And what I've heard from my staff, although I haven't looked at it, is that the guidance is good. So they feel good about the guidance that's been issued.
Good.
I know it's October, early October, so it's a little bit early, but have you started to collect flu data? Have you seen cases start to appear for flu?
Is there anyone on the phone that can answer that?
I'm just curious how it compares to previous years.
Yeah, what I can do is do a follow-up for you on that. I would just need to ask Indira or Betty, one of our folks in epidemiology, and we can get that data back to you.
Thank you.
You bet.
Yeah, I had the same question, Brooke, so thanks. Any more discussion on the COVID-19 update? Okay, not hearing any. We will move on to agenda item 5, which is the director's report. Brooke, just so you're aware, usually with the director's report, it's happenings over the previous month. And the board members are, can ask questions about any of the items in the director's report. So that's your opportunity to do so.
Thank you. That was my question. Can we ask questions? So thanks.
And I will start just to see if anybody has any questions first.
Jeff, I saw I'm not sure if you know this or if Joe knows this, but the mosquito control contractor, Vector Disease Control International, have they been your contractor before and they just renewed their contract?
I don't know the answer to that unless somebody else on the phone. Is Lane still on the phone? I don't think he is.
This is Megan. I can answer that because I just signed the RFP form. So we had Lane do an RFP. They've been our provider for the last 4 years. And we wanted to make sure before we went into the next 4-year contract that we renewed the RFP. They were the only contractor to come forward again, but we've had really good comments and results from them with partners and stuff. So we're excited to go ahead and stay with them for the next 4-year term.
Thank you, Megan. Any other comments, questions for Jeff?
I had a quick question on the works for the syringe numbers increasing. I was just curious if there what you think is driving that? Do you think it could be because of the mail program? Has that been pretty successful?
I don't know for sure. Let me see is there anybody on the phone who can answer that? I don't see anybody on the phone who's likely going to be able to answer that.
Okay, thank you.
I'll follow up though. I won't
Okay,
drop any of them. Don't worry.
thank you. And I had another question about the vaccinations for the COVID-19. Is there a chance that you all might be planning to present maybe an update on how the state is thinking about this and how it relates to the county?
Absolutely, we can do that. There was a call today, and there's been a fair amount of work, including a task force at the state level that's been working on that. So we could bring that to next month's meeting if that works.
Yeah, I would appreciate that if everybody else is okay with it.
That's fine. Hey, Jeff, on testing. So, I know there are metrics based on your population. Here's how many tests you should be doing each day to kind of satisfy that criteria of we're doing enough testing. Do you know what that number is for Boulder County and
Yep.
Are we exceeding that?
We are far exceeding it. It's 495, and we've been doing consistently, I don't have the testing graph in front of me, but upwards of 1,600 with the university tests in there per day. So we've never had an issue with not being able to have adequate testing in our county. We've often been testing below that number, but that's only because there's nobody waiting in testing lines. Everybody that was symptomatic was getting tested, but we're well above that 495 now with all the testing that's occurring with the university. I also do have good news. So right now we have the drive-up site at Stasio Ballfields, and the walk-up site that was occurring up on the hill has transferred over to the university. So the university is providing now both on-site and off-site testing for students. And Stasio Ballfields, we were just notified by CDPHE that they'll support that site through the end of the year for us, which is great news. We are going to be talking about if we relocate that site to somewhere that's a little more central to both North and East County. But that is really great news. So our testing numbers should really adequately stay up throughout the year. And that testing site, as I think you're all aware, is available to anybody that wants to use it. So we're getting really good surveillance relative to if we're seeing any kind of spread in our community.
That's fantastic news. That's really great.
That was, I wish Andrea was on the call because she reported that today at the agency administrator meeting, and I know she had a hand in that. She was in a meeting with CDPHE earlier today, so that was great. Great news.
That's all I had. Anybody else?
I had one more quick question. I apologize. This is probably just because it's the first time I'm seeing it, but I noticed under the HEAL update, the increased food insecurity that's being seen under COVID-19. Is it to the point where it's becoming concerning, or are we still able to meet most of the people that are coming into the program?
I see Joe's on the phone, so I'll see if he knows the answer to that.
So this is Joe, good evening. There definitely has been a bigger need, just with everybody's economically impacted because of COVID. I feel like that the funds they have available and the amount of resources they have to provide are being taken up. So I would have to say that if they had more funding, they would probably be able to provide more opportunities for folks.
Thank you. But do you think that they're greatly lacking? Like, is this?
I think they've done a really good job, especially this year over the summer, working with the farmers markets to partner with them just to make it more available. And I know they're doing deliveries now of fruits and vegetables as well. I don't know what the demand is related to the actual uptake. I could find that out and get back to you.
Okay, thank you. I was just really just curious because that just stood out. And again, it could just be because this is only the second time I'm seeing this update.
I know they've done just a really good job of transitioning the program where folks had to go to the grocery stores to really try to meet people where they're at and try to make it available. Again, trying to do delivery and just making multiple opportunities for people to take part in the program.
Great, thank you.
Thank you.
Okay, I think that was the last question.
Hey, Greg, can I just open it up if it's okay to see if
Absolutely.
my staff on the phone have any other updates they want to share with you all?
Please do.
Anybody go ahead if you have anything. Not seeing anything, so I think you're good.
Okay. All right, and that takes us to the last agenda item, which is old and new business. And this is generally, Brooke, where if you have any kind of news regarding any kind of professional events, announcements, it's really just intended, it's pretty open.
Great, thank you.
I do not have any.
Jeff, do you have any news to share?
I do. So I'm assuming that you all have seen my retirement announcement. I don't know if you have or not, but I have been planning my retirement for a couple of years now. And as we all know, there's really no perfect time to retire. But I'm looking at retiring in April of 2021. So I'll be here for another 5 months. I will certainly work diligently to make sure I have a great transition plan in place. As you all know, we have incredible staff in this organization. We're so strongly positioned that we're not going to miss a beat. And I just want folks to know that we really do. We have such strong leadership, and that is what has carried us so far in all these years. And that leadership exists and will continue. And I just really appreciate all of my staff for being in such great places in our organization in terms of capacity, motivation, initiative, and willingness to carry things forward. But I am planning on retiring in April.
Congratulations.
Yeah, congratulations to you, Jeff. But we are, I was sad to see that news and know that you have an awesome team working whose work will continue. But I'm excited for you and sad for us, Jeff.
Well, thank you. I appreciate that.
You're going to cure COVID, right, Jeff, before you leave?
Yeah.
Can you fix that first?
And then between Chuck Stout and you, how many years has it been?
Well, Chuck was, I don't even remember how many. I think he was over 20. And I am going to be at 31 when I retire. So that's a lot of years.
Yeah. Yeah, that's a lot of stability too. And it's nice you came up through the organization, and hopefully we have some real strong contenders on the bench that are counting down the days to April.
Yeah, this is such, I know you all know this, but this is such an incredible place to work. We have really great support from commissioners, board, legislators, community. It really is, of all the places to work in the state. Boulder County is an incredible place. We sometimes get made fun of for that, but I'll take the getting made fun of any time to have the kind of support that we've had. We've been able to do great things because of it, and you all are part of that process too. So keep that up and support our staff in moving things forward in really progressive ways, and we'll continue to be leaders. There's no doubt about it.
And thanks for, the ample lead time and planning associated with that, so. But yeah, we'll miss you, Jeff, but we still got you for a while, so no
Yeah,
sobbing on
I'm-
this, from this guy. Okay, unless there's any other items, we are adjourned. Thank you very much, everybody.
Thank you all.
Thanks,
See you.
everyone.
Thank you.
Thank
Bye.
you.
Thank you.
Thank
Bye.
you.